So we're going to talk a little bit about safety to make sure that your patients are safe in their class that you're doing. First thing I want to talk about is motor fluctuations. Parkinson's is a dynamic disease. Patients are going to fluctuate both from day to day and sometimes even within the course of the disease. They may be able to do things one day and may struggle in doing things the next day. It's important that you have an open and honest conversation with your patients. Ask them if they're on or if they're off. If they're on their medications, they might have dyskinesias or extra kind of wiggling movements like this. If they're off their medications, they might have more tremor or might be a little bit more rigid. You need to realize things like sleep quality, stress, how much protein they've had are all going to affect their medications and if they're actually on or if they're off their medications. Some patients may wear off during intense exercise. If this happens, make sure that you have a plan with the patient. Make sure that they're bringing their extra medications that they can take if they need to during the course of your exercise class. Something else to be aware of is orthostatic hypotension. This is when your blood pressure drops significantly as you change position. You may say to some patients as they get up off the floor quickly or if you're doing repeated sit-to-stands. It can lead to dizziness and sometimes lightheadedness, and sometimes patients might even fall. You're going to want to encourage patients to stay hydrated. Have them bring water bottles to the class, encourage frequent water breaks so that they can drink throughout the class. Sometimes you may want to slow down transitions as you're getting up off the floor, come into a all-four position or tall kneeling, and pause there before standing all the way up. If someone does become dizzy or lightheaded, have them sit in a chair for a little bit. If needed, you can have them actually put their head between their knees or have them cross their legs and squeeze and hold for 10 seconds. Both of these maneuvers help increase blood pressure. A lot of Parkinson's patients will complain of pain. Oftentimes, this could either be from Parkinson's or it could be from arthritic issues that have nothing to do with Parkinson's. I often say Parkinson's, though, is the great magnifier of any other issue you may have. Parkinson's, you have asymmetry of tightness. So oftentimes the muscles that bend or the flexors get really tight, and that puts extra load on joints. The most common painful sites in people with Parkinson's are the back, the neck, shoulders, and knees. You want to encourage pain-free motion. Although we want to push our patients with Parkinson's, we do not want them to have pain. You want to realize that flexibility can be limited, so you want them to have full range, be able to do the exercises before you add weights. Some patients may develop a dystonia. This is an abnormal cramping. Some patients will have this on medication or some people will have it off. Oftentimes, as an exercise person, I see it in the feet, in which case the toes will actually curl and the foot will kind of curl in, which can limit a person's ability to participate in your class. If this happens, talk with the patient and have them either follow up with a physical therapist or their physician to change their medication or try other techniques that might help. The last thing to talk about is balance and falls. Parkinson's is a disease which affects someone's balance, and there is a chance that a patient may fall in your class. Our goal is for you to find that happy medium where you're pushing your clients, but you're also maintaining safety. A few guidelines is have chairs available. Encourage patients to either hold onto the chair when they're first starting or maybe stand near a wall so that they can hold on until you know and they know that they can do the exercise safely. Another thing is encourage a wide base of support. Parkinson's patients tend to walk with their feet really narrow, which only further challenges their balance. Have them do lunges and other exercises with their feet wider apart, which is going to increase stability. You want to not do crossovers or grapevines. Studies have indicated that if patients start to fall and catch themselves with crossing their foot over, the chance of falling is greater than if they were to step straight out. So you don't want to practice something that you know is not going to be effective if and when they were to fall someday. Sometimes as patients start to pick up speed, which we often use in exercise to increase intensity, their form will suffer. They'll start getting smaller and smaller movement rather than taking big full range movement. So make sure that you realize that quality is more important than quantity. Another thing to realize is some patients with Parkinson's will have something called retropulsion. This is when you start to lose your balance backwards and you're unable to catch yourself. Oftentimes you'll see patients take short little shuffly steps and sometimes actually fall straight backwards. Again, although backwards stability is an issue with people with Parkinson's, we want to practice going backwards But you just want to encourage them to go slow, step wide, and again, maybe stand near them or be near a chair or a wall. And you'll see this tomorrow when we do this in some of our agility exercises. Cognition is affected in people with Parkinson's. So you'll see that we will use cognitive dual tasks as a progression, but just realize as we add that second layer of thinking tasks on top of the physical task, it may actually impact their ability to maintain their stability, and there is a chance to fall. At the end of the day, remember you as an exercise trainer are part of the medical team. If you feel unsafe at any time, make sure you talk with the physical therapist or the patient's neurologist to maximize the safety and the ability for the patient to participate in your class.